Hi, and welcome to the Classic Acupuncture Academy. Today, I would like to talk about the COVID-19, or what modern science calls COVID-19. Because in Chinese medicine, we do not use such terms. We are using the term of FENG. We have to find a way to expel the FENG. Well, what I will be explaining you today comes from the teaching of famous masters, such as Master Wu Wei Ping, who was the teacher of Lavie, Van Buren, and also Worsley, three very famous acupuncturists, as you know. But also from the teaching of the school of Hong Kong, with Master Leung Kok Youen and Master Shen, who was the director of the school. And maybe you have not heard about Master Shen, but Master Leung Kok Youen was the founder of, in Vancouver, of the Northern American School of Acupuncture. So these are famous masters who have transmitted their knowledge, and I hope here that it will help you. So first, what do we know about this pathology? We know that humidity will increase the risk of getting sick, which means that dryness helps. Another aspect is we know that the heat helps our patients. It will help to decrease the risk of getting sick. In fact, it seems that heat is destroying at some given points the virus. So heat is our friend. We also know that this disease is more affecting the elderly than the young. Than young people. What does that mean? Well, all of this corresponds to the yang. So we have to find a way to expel the feng and also to increase the yang, wei qi. Okay. So what do we know about this pathology? We know that it is affecting our breathing system and at some given times our lung. You have cough, dry cough. You have also distended abdominal area, and you have diarrhea. To what layer does it correspond? Well, if the feng is at the Tai Yang layer, you have what as symptoms? You have shivering. You are shivering. When it gets deeper to the Shao Yang, you start to have fever and you have stiff muscles because the gallbladder controls the fever and also our muscles. The more it gets deeper, the more dangerous it becomes. Well, dry cough, distended abdominal area, and diarrhea, vomiting are all symptoms of the Tai Yin, which corresponds to humidity. The Tai Yin is composed of the spleen and the lung. At the opposite, we have the Yang Ming. The Yang Ming is dryness and is composed of the stomach and also the large intestine. Here we know that the spleen, as it is part of the earth element, represents humidity. And the lung here is here to balance the spleen's function. And here there is an imbalance, the lung being weak and the spleen being in excess. So we have an excess of humidity, of dampness. So we have to expel the feng. So first of all, let's see how we can do that. So the feng can get through our breathing system. can get inside. Okay, but also we know in Chinese medicine that the FENG will get inside our body first by getting through the channel. So it starts at lung 11, the Jing point. If nothing prevents it from moving inward, if the above the shu point, the FENG will continue up to the he point, and from the he point it gets to the lungs. So what we have to do is to expel it and also to send it backward. What point can we use here? We can use bladder 12, dispersed, bladder 13, dispersed. I would even bleed both points and use cupping on both points. Now we can use also lung 5, dispersed. That way we're sending it back to the channel. And from here, we have two options. We can use lung 7, which is the lower point of the lung. And also, it's an interesting point to disperse the excess of yin energy in the upper burner. So through the lung 7, we are connecting also the lung to what? To the large intestine. That's precisely what we want to do. And here we have to tonify large intestine 4. Okay. And finally, we can use lung 11. I would suggest to disperse it, but also to bleed it. Here we have used the point necessary to expel the FENG, but we have to increase the immune system. Well, the School of Hong Kong taught that if the FENG is at the Tai Yin level, you have to use Renmai 12 and stomach 25. Well, here, these points are the mu point of the stomach and the mu point of the large intestine. So we are working on what? On the Yang Ming. Renmai 12 here is also a very interesting point because it's also the meeting point of the Tai Yin. By tonifying Renmai 12 and increasing the energy of the stomach, you are drying the spleen and you are sending energy to the upper burner and especially to the lung. Stomach 25 is also part of the lung primary channel. Both points are. So by tonifying both points, you are increasing the Yang Ming and also tonifying the lung. What other point can you add? Well, as I said, you have large intestine 4. You can use also large intestine 11, which is a mother point of the large intestine. And you can use stomach 36, 25. We know that elderly people are more subject to this disease. We have to help them, and because they are weaker. There is a famous point for the elderly, which is bladder 43, which has to be tonified. Except that this point in traditional text is said to be a hidden point. So most acupuncturists place this point at only 3 kun. And in the text, it is said to be hidden at the shoulder, behind the shoulder blade. If you look at our spinal column with the shoulder blade like this, shoulder blades like this, if you move this way to the side by 3 kun, you will get before getting to the shoulder blades. And the point is hidden here. It's at 4 kun. So to be able to puncture this point, you have to ask your patient to put his hand on the opposite shoulder, and the shoulder blade will rotate and you will see the point. So this point has to be tonified and heated with moxa. How many moxa? Usually I use 5 to 7 moxa on each point that has to be tonified. So all the points I already mentioned of the Yang Ming, I would use tonification with 5 to 7, even 9 moxa. Now, what other recommendation can we give to our patients? Well, first of all, they have to avoid yin energies, which means that they have to remain in places which are hot, with less humidity. They have to eat food which is more yang than yin, which means they have to avoid cold food, cold drinks, and to drink tea. You can also add in your tea lemon, ginger. All this will help. I'm not a specialist of herbs. There is other people who are, so I will not develop this subject here. Another recommendation for yourself. Well, if you're running an office of acupuncture, you have to have a special room for people who are infected. You have to clean the room every time a patient comes for such a disease. Use a separate entrance for them. What about yourself? Well, you have to use masks, glasses, gloves, everything to protect yourself, and wash your hands. And I would recommend, just for yourself, just take care of yourself, because this disease will develop if you are weak. So sleep well, eat well, rest. Do not exhaust yourself uselessly, especially now. Take care. If this video was useful to you, please share it. And if you wish, you can follow us on Instagram, YouTube, Facebook. And if you want to learn more about Classic Acupuncture, please visit our website, classicacupunctureacademy.com. Thank you.